Is epilepsy predictable? Epilepsy is a chronic disease characterized by recurrent seizures. Epilepsy is believed to be a random occurrence of spontaneous seizures. One of the most disabling aspects of having epilepsy is the seeming randomness of seizures. Epilepsy researchers around the world have been working for decades to identify patterns of electrical activity in the brain that signal an oncoming seizure, but with limited success. It may soon be possible for clinicians to identify when patients are at highest risk for seizures, allowing patients to plan around these brief but potentially dangerous events. Some people can feel a seizure coming on. Brief storms of electrical activity in the brain cause convulsions, hallucinations, or loss of consciousness. Due to abnormal electrical activity in the brain, numerous symptoms, including a loss of awareness or consciousness, changes in the senses, hallucinations, numbness, feelings of electric shocks, drooling, convulsions and difficulty in breathing occurs. After the seizure, people can be unresponsive, confused, scared or tired, among other lingering effects. A recent study shows seizures might not be random, but rather follow daily or monthly cycles in the brain, and cracking that pattern might help doctors to predict and treat epilepsy. Published on 8th of January 2018 in Nature Communications. Dr. Vikram Rao, an assistant professor of neurology from the University of California, San Francisco, is the senior study author. This daily to monthly patterns in seizure occurrence have been described since antiquity. But recently it is quantified, revealing circadian and cluster organization. The existence of such patterns suggests that brain activity is regulated by definite time scales. Scientists noticed a cycle of electrical activity in the brains of the epileptic patients and found the seizure pattern typically fall into a definite cycle. The researchers saw that a certain kind of electrical pattern seen in people with epilepsy cycled in periods between 20 and 30 days. Those periods are robust and relatively stable for up to 10 years in men and women. The team referred to the pattern that increases and decreases seizure risk as brain irritability, and notes that seizures tend to occur as the pattern is rising toward its peak. Patients are most likely to have seizures at a certain time of day, showing a link to the body's circadian or biological rhythm. Thus, seizures are organized by underlying biological rhythms that operate over multiple timescales and jointly modulate seizure risk. Forecasting patients' seizure risk helps to avoid potentially dangerous activities such as swimming or driving when their seizure risk is highest, and to potentially take steps such as additional medication doses to reduce their seizure risk. If your neurologist can't tell you if your next seizure is a minute from now or a year from now, you live your life in a state of constant uncertainty, like walking on eggshells. If you forecast there will be a 5% chance of a thunderstorm this week, but a 90% chance next week, it may be useful to people. That kind of information lets you prepare to face the catastrophe. Thank you.